Hey, welcome back to this week's podcast. I'm so excited to be launching into 2024 talking about some women's health related issues and specifically things that you should know about when you go to your doctor's appointment. So lots of us this time of year making doctor's appointments, getting into, our health goals and wanting to know more about our health and prioritizing our health for this year. And we just want to talk about some of the things that are unique to women's health and maybe things you're not aware of that you should be talking with your physician about specifically.
Great.
So
Yeah. So one of the things I think that, and I know Jenny, you're in the same wheelhouse, is making sure that there's a separation between men and women because
yeah.
it's significantly different when we start looking at questions we should ask and also how we should be treated physically and as far as prevention is concerned as well. And I know you're going to go in on this topic a little bit.
Yeah, absolutely. So, I think kind of just taking a broad step back, like you were saying, it's the difference between men and women. And so when we start talking about what should you be asking your physician about, I think it's super important that that they have a good understanding of what the difference is, particularly for you. And that could be men versus women for sure, but you as an individual, what is your genetics? What is your family history? How is that playing into the presentation of what they're seeing, and so case in point this week, I just went to my physician and did a similar work through, and he's wonderful. I've loved him. I've been there for years, and he ordered blood work for me. And one of the things we put on there was vitamin D, and he had to put all kinds of funky stuff on there to get it covered, right? Which is always interesting. But because my mom has brittle bone issues, right? And so making sure that even though I'm a young, healthy person, I lift weights and doing all the things, I certainly don't look fragile and frail, like making sure that my vitamin D levels were checked. So I think, one question I always think is important is how does this relate to me? Is this something maybe not everybody should have checked, although I would argue everybody should have their vitamin D levels checked. Specifically when it came to my family history, he thought that was important. And I think that is a huge, positive thing, but something you should be aware of as well is how does your family history indicate maybe what tests should be done or what things should be looked at for you?
Well, and like having a physician open to being willing to test that vitamin
Right.
D without asking questions. And, we talk about taking that broad step back. It's maybe you're interviewing your physician, right? I think a lot of us, men and women, believe that our physicians have all the answers and are
Yes.
going to cover all the bases and dot
Mhm.
their T's or dot their I's and cross their T's. And sometimes things get overlooked. And I'm sure most of it's accidental because, just the day to day in and outs of being a physician. But I think there is some value, and especially for women, is coming to your physician and asking questions of maybe finding out how they practice and why they got into the practice to begin with, and seeing their values to make sure they align with yours. So instead of us seeking out a physician and essentially them taking us on, I think it should be opposite, us choosing to take a physician on.
Yeah, absolutely. And I love that you brought that up. I think in the US, because of the way medicine works, and it's not an intentional thing in most cases, right? But the insurance driven model requires them to see a new patient every 10 minutes for the entire day. So there's no possible way that they haven't confused you with Susie to some degree, right? Even if they're really thorough and really good. And so, making sure that you are finding somebody who aligns with you and who is asking those questions specific to you is super important. You're probably not going to get the opportunity unless you're working with direct primary care to ask those questions ahead of time. You're going to have to go into your first visit and make sure you have those questions ready. And they probably are ready to give you that 10 minutes or maybe 15 minutes or 20 minutes that they really are allowed to give you. So being intentional and direct in how you approach that and what's most meaningful to you too, I think is important.
Making sure that you're not being treated because you have symptoms that someone else might have. You're being treated a lot of times, especially with women, hormonal changes, and then them coming in with symptoms that may appear in other women as well. You're being treated the same as the next person. And a lot of times when that happens, things get overlooked, things
Mhm.
get, quote, normalized, and then the symptoms are masked, so to speak. The problem is not identified or treated. And so this is where when you're interviewing your provider, you also have the opportunity to vocalize the need to be heard. So if I'm coming, I am concerned, I'm in my 40s, I know my body's changing. Are you able to help with this transition for me? Like, that's a great way tactfully to say, like, I need you in my corner through this because I am maybe reading and noticing things that I need to be aware of. And I need to know as my provider that you're going to help me.
Yeah, absolutely. So I love that. And I think, finding somebody who's a good match for you, step one, right? Somebody who's going to hear you, who's going to listen to you, and who aligns with your values, whatever that might be. I think step two then is diving into what you find, right? So not allowing those symptoms to be brushed off, to be heard, but then also to be answered, and have those questions like, what do you think could be causing this? What else am I doing? Or what else should I be doing to prevent this or to keep myself healthy? Or what labs do I need to have run to know that this isn't a problem for me? And what do I need to do with those results? What do they mean? So I think all of those are very valid questions. But if you have a provider who's not really sitting down and taking the time to explain to you, not just what you have going on right now, but what you can do to prevent it or to improve your likelihood of not having something get worse in the future is super important as well.
Well, and I think also going in with certain symptoms or complaints, sometimes something is prescribed before knowing what the problem is. So it is okay to say, these are my symptoms. What can we do to test? What kind of lab markers can we get in order to make sure that this oral contraceptive is the best mode for treatment? Or or,
It's
or
not, PS, by the
I
way.
know, but like my point is, I
No, I know.
like
You know.
it allows you to tactfully put your foot out there to say, hey, I needed more information before I can buy into just taking a medication that is going to mask the problem. Right. Ask the
Absolutely.
questions, get tested. The numbers and the data will help us figure out and dig deeper to what is actually going on in the body.
Yeah. I have a great example actually that just came up with a client a few weeks ago on that. She was having some symptoms of an infection and had been to the doctor, and they said, we'll just send in, okay, I guess it's turned into bacterial. And now, the symptoms matched, right? We'll just send in an antibiotic for you. And she said, what do you think? And I said, they're going to send in a broad spectrum antibiotic because they haven't tested for what it actually is, right? Whereas if you're testing, you can actually target and probably not kill off as much of that good microbiome that we've worked so hard to build. But oftentimes it's cheaper, it's faster to go ahead and just prescribe, and and then you're not, one, getting to the root cause, but two, maybe probably over medicating things that could be handled in a much better way that will set you up for success in the future too.
And a lot of times when we are going kind of that blanket antibiotic or the blanket medication, it ends up being a domino effect leading into something else. So
Right.
say candida or yeast or
Right.
something that could have been prevented. That's where functional testing, I feel, I mean, yes, I'm biased because it is how I
Mm-hmm.
practice. I know it is
Yeah.
you practice too, Jenny. But I think that's where functional testing and labs are so pivotal because they pinpoint the ranges are smaller, they tell us more. It's not just serum plasma. We're looking at urine, we're looking at saliva, all of
Right.
these things that give us such better markers for health. But I think those functional labs also allow us to see things that we can prevent and not
Yeah.
just as well.
Absolutely. And I think the other benefit we have in the functional world is sitting down with somebody for an hour, right? Not 10 minutes, not 15 minutes, not I'm 30 minutes late and I'm thinking about the other 46 patients I had today. I have an hour dedicated wholly to you, and I probably don't have more than a couple of you today. So we can really dive into what are your symptoms, what are your concerns, how do those match up with both your serum labs and also your functional labs, and how can we create a plan for you to get to the root of the problem you're having and not acknowledging it as just a normal symptom of aging, which I swear is just the bane of my existence. It's nails on a chalkboard to me when I hear that.
It's maddening. And I think for women too, I think going in and yes, there's questions of maybe wanting the symptom to go away, right? Like
Mhm.
whatever that might be, whether it be the brain fog or fatigue or bad PMS symptoms or skipped periods, whatever it might be if you are a female. But also being mindful of the longevity of health. When you're asking these questions with your provider, ask the questions that are actually going to educate you in how to live your life and move forward into the many years to come, right? Because it's not a start or stop when it comes to health, right? Like we're not just starting this journey and then we're going to stop once we just start feeling good, right? It's a continued process. So the more you know and educate yourself, the higher quality of life you're going to have.
Yeah, absolutely. And I think if you have a provider who can't answer those questions for you, right? Who can't answer how this is going to help you long term, or what impacts it's going to have for you short or long term, this treatment you're on, it also might be time to start talking about my last thing, which would be it's okay to break up with a provider, right? There are a ton of providers out there. As Rachel mentioned in the beginning, we are hiring them. I know there's a whole lot of factors that go into that with insurance and everything else. But at the end of the day, they should be there to collaborate for you and with you, and not as the person who's barking orders at you because they don't live your life. They don't have those symptoms. They don't feel what you feel. And so if it's not a good fit, being okay to say, I'm not sure this is a good fit for me. I would like my records to go somewhere else is a reasonable question to ask. And any reasonable provider should be more than happy to give those to you.
Well, and I think if you're ever in a situation where you're sitting in that room and you feel smaller than you need to feel, right? Like with the
Right.
provider, or you're talked down to, or you feel like you're not being heard, those are all signs. There's nothing that you personally are doing wrong. If you're asking the questions and you're being answered in belittling ways or in ways that you're not being heard or respected, that is a red flag that
Right.
this relationship between your provider and yourself is not working out.
No, and it's a one-sided relationship, right? And we all have had bad relationships in our life, I'm sure at some point. Don't let this be another one. You don't need to have those feelings. So I love that 100%. I think that's super important that you feel confident, you feel safe to share, and you feel like you're in good hands that you're going to get the results you need for your own health.
Yeah, I agree. This podcast is really meant for us to feel more empowered and to take control of our health and for us to be, our own advocates going
Right.
to our physicians and asking for what we need in hopes that they'll hear us. So, we may be able to list some of these questions in the show notes. So that's something we could also do. But just being mindful that making sure that you know who your provider is and understand his or her values, and that you're able to speak up for yourself and the needs that you personally have right now.
Yeah. The last thing I would add is I think it's super important that you go into that visit prepared, right? That you have true knowledge of what am I feeling? How am I feeling? What do I want to prioritize for my health? And I say this because I feel like, and I'm going to use an analogy, but I go to my hairstylist almost every time and she says, what are we doing? And the answer is the same because I haven't really thought about it, right? And so don't be that with your physician. If you've been not feeling well and you're like, well, I'm just going to my annual physical because that's what I do and everything's fine, I'm fine, but you know it could be better. You know you could feel better. Those are things that it's really important for you to reflect on ahead of time so you can put those thoughts together and say, I've been feeling this, I've been feeling that. I don't want to feel this anymore. I'd love some help with this. And so as a tool for you, one of the things we have on our website is a free download for a medical symptom questionnaire, which is something I like to use a lot in functional medicine. Some things that people won't even think, oh, that's a symptom or that's not normal. Are you constipated? Are you having bloating? Are you gassy? Are you belching? Like all of those things are things that are not necessarily normal unless you've had probably the wrong things to eat or you have the wrong things growing in your stomach, right? And so I think just those kinds of questions to get you thinking about what should I be asking about? Do I have these symptoms? Have I not even noticed how common my headaches have gotten because I have them all the time? That kind of stuff.
Yeah, not normalizing it, right?
No, absolutely. But also not even in our own heads normalizing. We can't get help
That's
if
what
we're
I
not
mean. We
saying
can
it.
really
Yes,
easily do that to ourselves. Well,
we
it's been going
do.
on forever. It's probably just that I ate this. It's nothing like we've all done it. We all do it.
Yep,
So it's just basically us saying, if you are experiencing these things, I think it's time. Maybe do the questionnaire. That's a great tool. We should all, I should do it when I get off here. Right. It's one of those things that like we're all in this field of making sure that we start looking inward a little bit more so we can prepare ourselves for, a healthy life.
absolutely. And when you talk about empowering, nobody's going to be a bigger champion for yourself than you. And so being informed, being your own advocate, asking those questions, having them ready, having that knowledge and self-reflection to know what is important to you, and then finding somebody else if you're not finding what you're looking for are all super important things to help you find the healthcare you need to make 2024 your best year yet.
Well said. I love it.
Yeah. So if you're looking for some help and you feel like this resonated with you more than any of the last medical appointments you've been to, Rachel and I do both work with clients directly. And so you can reach us on our website at altogetherwellness.net. You can also download that questionnaire there and get more information and then book a call with us so we can help you out this year too.
Thank you.
All right.